Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we're here again, and always remember that I'm loving all of those emails. Remember, caring and sharing. www.medmoments.com. Email me, guys. Let me know what's going on out there. Let me know what your med moments are. Remember what a med moment is now. A med moment is that time when you're walking upstairs and all of a sudden you got a little chest pain. Oh, I think I'd better see my doctor. That's a med moment. Let me know about your med moments. Also, you can tweet me at medmoments. Well, we got a great show. And we're going to talk about a topic tonight that's I think all of us thinks about this at one point in time. We're going to talk about cancer. Not a specific cancer, but we're going to generalize. We're going to try to understand, I should say, what is cancer? And I have the perfect person to explain all of the details about cancer. His name is Dr. Kevin Clark, and he's a surgical oncologist. Dr. Clark, welcome to our show.
Thank you for having me.
All righty. Well, we're here again. I know that you're a frequent visitor to this show, and it's simply because the topic that you cover is just so important. Today, I'd like to cover cancer, and cancer in a way that, put it this way, that my grandma could understand. So she would know exactly what's going on if it occurred to her. Okay. Let's just start out with a simple. What is cancer?
Well, it's a complicated topic, but to give a definition that's, I think, basic, it's an abnormal growth. So it's a lump, it's a mass of tissue, and that tissue has the ability to not only grow, but it has the ability to go to other parts of the body or spread. And that's really the definition of cancer. It's two things: abnormal growth and spread.
Okay, all right. Now, understand that, and from readings, I understand that cancer originates because there is a abnormal gene or something that goes haywire in the cell that makes it do funny things.
Right. So there's a lot of things that have to happen for cancer to develop. Many steps have to happen. Okay. The earliest steps, one of the most important things, or one of the hallmarks, it's uncontrolled growth. So what normally happens is our normal tissues divide, and they have signals to tell them when to divide and when not to divide. Okay. What happens in cancer, unfortunately, is that signal to shut division off is lost. So cancer cells continue to divide, and they lose the ability to shut that off, so they just keep growing. In addition to dividing, they also have the ability to go into tissue, or what we call invade. And it goes from one spot and travels all throughout the body. And that ability, as you mentioned before, is acquired through problems with the genes. Okay. And we can talk a little bit about what the genes are. Right. Genes are, it essentially directs the cell or tells the cells what to do.
So what you're saying is that a gene would tell a liver cell what to do for the liver, or a lung cell how the lung should function or whatever. Right. The genes direct how those cells are actually functioning.
Correct.
Alrighty. Now, in the cancer, when the cancer cell, like for instance, if I had a cancer cell in the lung, would those cancer cells function as a lung cell even though they're in the lung?
So no. So what happens is the cancer cell, it doesn't function the normal way a normal cell does. Okay. It's from that original tissue, right, but the normal function is lost.
Right. Okay. So, for instance, if I had a cancer cell, just to backtrack, because this is to me it's complicated, and I just want everybody to understand. A gene or the makeup of the cell, or what determines how this cell is going to function, and we call them genes, is it kind of goes haywire. Right. and it causes the cell to replicate or multiply or just divide millions of times faster than it should.
Correct.
And it builds up into this mass, and if it's a lung tissue, then the tissue really doesn't function as lung tissue functions. It's just a mass there taking up space.
Correct.
Okay, yeah. And it's still growing.
And it's still growing.
And there's nothing to turn it off.
Right.
That's bad.
And not only does it take up space, actually by taking up space, it prevents the normal tissue from functioning.
Oh, okay.
So that's one of the problems also. So it grows and it actually impedes or obstructs the normal functioning tissue.
Okay, okay. All right. Now, how do we find cancers? And should we try to find them early as opposed to later?
So the best way to find cancers, or the best method that we have is what we call screening. So screening is to try to identify cancer at the earliest point where you can intervene. And we know that when we intervene early in cancer, the outcomes are much better.
Now, when you say intervene, I mean, that's kind of a big word there,
Right.
but what do you mean by intervene? You're going to, put up a stop sign, or what do you mean by that?
Well, depending on the particular cancer that we're talking about, that intervention could involve surgical intervention or some sort of treatment involving chemotherapy and or radiation. So there are different therapies that we use to treat cancer.
Okay, all right. Now, in identifying it, and what I mean by finding it, is that do we use, different techniques? Do we use X-rays, or how do we find these things? And what would alert me to even look for it? I mean, how would I know as a doctor if somebody walked into my office and I'm saying, I'm gonna have to send you for something,
So two things. Unfortunately, with cancer, when people present with symptoms, so for instance, if you have abdominal pain,
right.
If you have rectal bleeding, if you can palpate a breast mass, if you're coughing with blood, these are all symptoms that are consistent with or can be related to certain cancers.
Right.
When patients present with symptoms, by definition, it's already advanced. So at that stage, we can infer that the cancer has gone through several steps and it's now an advanced cancer.
Okay.
Now the goal of screening, and there are different methods of screening, is to catch the cancer at a much earlier time point where intervention is much more effective. Now the things that we use for screening depend on the particular cancer we're looking for. So for instance, breast cancer, we do mammography. Colon cancer, we do colonoscopies. Prostate cancer, although it's a little controversial, PSA, digital rectal exam. So each particular cancer has a particular screening modality that's associated with it. And the goal really is to catch it at an early time point where interventions are much more effective.
Okay, all right. Let's just go a step back just for a minute, because I know we try to catch cancers early. When cancers spread, how do they spread? I mean, is there a method for it to going from the lung to the liver, or how does it get there? How does it get around the body?
So let's take a step back, because the process itself is pretty complicated and it's pretty inefficient actually. And it's 5 steps. So one is growth, one is invasion into the surrounding tissue.
So that's like growing into the surrounding
the tissue.
Right.
Then it has to leave that site, get into the bloodstream.
Oh.
Then from the bloodstream it has to go to another site. And then from that other site it has to start growing again. So all of these steps have to happen for the cancer to go from one site to the next site. Okay. And all of these steps require the cancer cell to have multiple replications and multiple mutations.
Okay.
Now, the cancer spreads through the bloodstream. It spreads through direct invasion to other areas, or it could go through the lymphatics. And the lymphatics, it's a parallel system to the blood, the blood system.
It's a system just like the blood that carries fluid.
Right.
Okay. And the cells get in that fluid and it'll travel that route as well. So it can either invade directly if I have the liver here and another something else sided, it'll just grow right into whatever's next to it.
Right, directly into it.
Or it can go into the bloodstream and travel. So a cell will jump into the bloodstream and travel wherever it stops, then it just starts replicating there. Correct. And growing a mass there. Or the lymphatics is a kind of a channel of fluid that it can jump into and travel that way as well. Now, what's a lymph node? I understand often you hear the cancer is spread to the lymph nodes. What is a lymph node?
So lymph nodes are part of the lymphatic system, and it's part of the immune system. And what a lymph node is really, it's a structure where you have a collection of lymphocytes. And lymphocytes are cells in the body that are part of the immune system. So they treat infections, viruses, that sort of thing. So the lymphatic system consists of the lymphatic channels and lymph nodes. Okay. So when the cancer drains into the lymphatic system, one of the first points that it actually gets to is the lymph nodes. So that's why when we say cancer has gone to the lymph nodes, it means it's traveled through the lymphatics and it's gone to this particular spot. Okay.
And usually that's spread outside of the initial cancer mass. All right. So that's when it's spread. It's in the blood vessels, it's in the lymph nodes, or it's gone through the tissues. Right. Okay. All righty. What are the most common types of cancer? I know females may have the most common type, and males. What should we worry about out there?
So certainly in males, prostate cancer is the most common cancer, and in females, breast cancer. Okay. So those are the top two in male and female respectively. Second, in both areas, male and female, is going to be lung cancer. And then third is going to be colon cancer. So these are the top three cancers top four cancers that we see. Much less likely are things like pancreatic cancer, esophageal cancer, bladder cancer. Those are much less likely.
Okay, all right then. And we'll go into specific tests to find those cancers. And I know you mentioned it briefly, but we'll go maybe, if we have time, we'll go into it. Tell me about family history. If you know what I mean. Is that important as far as cancer is concerned?
Very important. What we know is, so just taking a step back, the way how cancer develops, it develops because there are what we call mutations or changes in the genes, and the genes are what direct cells to do certain things. Right. So it can happen sporadically, which means that just by chance, the cell develops these changes. Okay. Or it could be inherited, meaning that a particular family member can pass those traits on to another family member. So one of the things that we look for is in families where patients have multiple cancers, or if a cancer starts at a very early age, then we suspect that there may be a particular mutation that's inherited or that's transferred through that family. Okay. And in that situation, we tend to potentially treat the patient a little bit different than, say, the patient who just gets cancer sporadically.
You mean you treat them earlier, or you treat them more aggressively? Or
sometimes more aggressive, certainly earlier, and sometimes more aggressive, because they tend to get cancer at a much earlier time point than the normal. All right,
so younger
person, right?
They get it at an earlier time in life, right? And it can be more aggressive, maybe.
Correct.
Okay, all right then. To answer, there's a question I've heard it many times: is that if I allow the doctor to take me to surgery, and he cut the area of cancer, right, it's automatically going to spread everywhere. Right. Myth, or is this true?
So it's a myth, okay, first, and it's an association that has developed. And what happens in certain cases when we go to operate, when we open up the abdomen, for instance, we are doing for colon cancer. In certain cases when we open up, the cancer has gone all throughout. Okay. And it's not because of the surgery, but it's just because of the particular stage that cancer is presenting at. Okay. So the surgery doesn't cause it to spread, but it's just the particular stage that person's at.
Right. Now, stage, since you mentioned the word. just give me an understanding what you mean by stage. You know, I understand as doctors we say I'm staging the cancer. What does that mean actually?
So stage is our way of simplifying it actually, so that we're all talking the same language. Mm-hmm. And stage is our ability to classify it in terms of how far or how advanced it is. Okay. So stage, and we put numbers to it. So it's stage 0, 1, 2, 3, and 4. 0 being the earliest, 4 being the latest. Mm-hmm. And stage relates to how big the cancer is, how far it has invaded, whether or not it's gone to lymph nodes, or whether or not it's gone to distant sites all throughout the body. Okay. So the earlier the stage, the better the outcomes. The later the stage, the worse the outcomes.
Okay, so if I'm stage 0 or stage 1,
right,
then I have a better chance of doing well with whichever therapy is appropriate, be it chemotherapy, be it radiation, be it surgical, and I have a better chance for cure.
Correct.
If it's stage 4, that means it's gone somewhere else. Say if it's lung, then it's gone to someplace else, right, the liver, right, which is nowhere near the lung.
Right.
And the likelihood that whatever therapy the doctor gives me, it's only going to give me a little bit more time. It's not going to cure the problem.
For the most part, yes.
Okay. All right. I just want to be in the ballpark here.
Yes.
All righty. Talk about weight loss. All right. I know so many patients with cancer, they have a problem with maintaining weight. Why is this?
So just like how cancer tends to present sometimes with symptoms, weight loss you can look at as a particular symptom. Okay. And again, it's multifactorial, which means there are multiple things that play a role. One, sometimes the cancer produces a syndrome called cancer cachexia. Cachexia, it's a big word, but what it means is that the cancer is so advanced that it produces substances that causes the body to break down.
Okay.
Mm-hmm. So you lose weight because you could think of the cancer as eating the body itself, right, from within. Also, patients with cancer sometimes don't want to eat. Oh. They don't have an appetite. Mm-hmm. And depending on where the cancer is, if it's in the GI tract, they may not be able to eat. Right. So there are multiple things that play a role, but weight loss is a significant sign. Whenever we see that, we're concerned that it may be an advanced cancer.
Okay, all right. Tell me about diagnosing. Do you always have to take a biopsy of that mass or whatever that is there to get a diagnosis that it's cancer?
For the most part, yes, mm-hmm, because you always want to confirm before you start treating. Mm-hmm. There's particular cases where we will institute treatment before we get a diagnosis because the scenario it's just such that there's nothing else that it could be. Right. But for most cases, you have to get a biopsy to confirm what it is because treatment is going to be dictated by the type of cancer and by the stage.
Okay, all right then. The doctor that actually gives you the diagnosis, I know and you're a surgical oncologist, so once you take the biopsy, mm-hmm, and you give it to that particular doctor that's called a pathologist, what do they look for or how do the cells look or, that they know that it's cancer? Can you give me some understanding of what they are seeing? So there are two things. There's a biopsy and there's actual gross specimen. So okay, the way gross specimen means I know these fancy words, but
so gross specimen means after we've done the operation, we take everything out, what the cancer actually physically looks like.
All right, the tissue that you take out.
The tissue that we take out.
That's a gross specimen.
And it looks fleshy. It looks fleshy and it's white.
Right. And
it has the appearance, or the term crab is what cancer is. It has that appearance of infiltrating. Right. So that's what it grossly looks like. Okay. Now, what the pathologist looks at, he looks at it under the microscope, mm-hmm, and what he's looking for is features that differ from what the normal cell looks like. Okay. So the normal cell is round, mm-hmm, and the shape is uniform. So what cancer cells, they're much larger than normal cells, and they're irregular. Okay. So those are features that can differentiate what the normal cell looks like from the cancer cell.
I got you. All righty. Mm-hmm. there also, I understand that even to help us identify where a cancer may be, there may be markers. Tell me what markers are. Some of the things that new research have come about that have given us, we can send bloods for and get some kind of marker to tell us about different types of cancers. Tell us about this.
So tumor markers are interesting, and the history is still evolving. So what tumor markers are substances that are secreted by the cancer. And those substances can give us an idea, if we measure it in the blood, of how advanced the cancer is, or in some cases, what cancer it is.
Oh, all right.
The problem with tumor markers is they're not always elevated in cancer, and they're not specific to a particular cancer.
Okay.
So just because it's elevated, I can't tell you it's this particular cancer. So you kind of have to use it with caution. Now, there are other markers that are coming along that are more specific, and as we get more knowledge, we're going to be able to say that this particular marker is consistent with this cancer at this stage. Right. But that's a little bit further down the line.
Okay. Describe benign and malignant to me, the differences. Can you give me an idea of what that is?
So both are growths. We're going to start with the basic premise that a tumor is a growth of tissue. A benign tumor is a growth that stays in one spot. It doesn't move and doesn't have the ability to move. A malignant growth or tumor, or cancer actually, has the ability not only to grow in that one spot, but can invade and go to other sites. So that's really the difference.
Okay, all right. So if you say you have a malignant cancer, then it's moving, it's growing, it's hot, it's off and gone.
Right.
A benign tumor is one that is a mass, but it's just there, and if you take it out, you've got it all.
Correct.
All right, so it's a cure.
Right.
Okay. All righty. Can cancer be anywhere in the body? Are there areas of the body that cancer just doesn't go?
Theoretically, it's hard for cancer to get to. No, actually, cancer could go anywhere. That's the simple answer. Because sometimes we think that it can't go certain places, and as soon as you say that it's exclusive, you find cancer.
You find it there, right?
There's really no area where it can't spread.
Okay. Are children less likely to get cancer than seniors and older people?
Yes. And the reason is cancer is usually a disease of aging. So what happens over time, the changes that we spoke about in the cell, those build up. And as those changes build up over time, you're at increased risk of getting a cancer. Right. Now, the older you are, the more time you have for those changes to build up, and the more likelihood of you developing a cancer. Right. In kids, the incidence of cancer is much lower, and the types of cancer that kids get are completely different from what adults get. And the causes, it's usually more related to genetic or inherited factors more so than sporadic changes.
Okay, all right then. As far as support, all right, I know cancer is, that word strikes to fear in just about all of us. All right, it can be a family member, it can be us, it could be anybody who could get it, and it really strikes fear. In supporting the patient, how do we support the patient with different things like the pain, depression, the weakness that may come about because of it? Are there avenues that we can support these patients appropriately when this occurs?
Absolutely, and I think it's important to recognize that you have to have, the patient has to have support. So, especially when you're given that diagnosis, as soon as you give somebody the diagnosis of cancer, there's nothing else that they hear. Right. And with treatment, patients are going to need to have help with just everyday activity, irrespective of dealing with the cancer, just to help them with shopping, taking care of their basic needs. Right. What we encourage is we encourage family members to get involved. that's the best situation. If family members can't get involved, then we have support groups and we have social workers. So we always have or make sure that there are avenues out there so that patients can always reach out for things that we know they're going to need and things that we're going to anticipate potentially that will come up.
All righty. We're running short on time, but I would just want to ask about treatment just for a minute. Chemotherapy, and this is something that, you know, so many patients out there are taking chemotherapy at this particular. How does the chemotherapy know to kill the bad cells and not the good cells?
It doesn't. That's a problem. So chemotherapy, and we've gotten a little bit better, but chemotherapy kills both the bad cells and the good cells, and that's why we get side effects.
Okay.
So it targets cells that are rapidly dividing. So cancer cells are rapidly dividing, but so are also other cells in the body. So skin, the cells in the intestinal tract. So the chemotherapy not only kills the cancer cells, but it also kills some of the normal cells, and that's why we get side effects from chemotherapy.
Okay. You know, we're going to have to end it right there, and it's a pleasure to have you on again. I just want to say that this is Dr. Kevin Clark. He is a surgical oncologist at Newark Beth Israel Medical Center, and I am so happy to have you here.
Thank you.
All righty. In closing, remember, sharing and caring, www.medmoments.com. Also, tweet me at medmoments. Something I want to say, never institute any change in your medical therapy until you consult your physician. I trust that each and every one of you could have continued good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all. Thank you very much. Thank you. Excellent. Very, very good.
I tried not to use any big words. I tried.